Therapeutic Nurse Patient Relationship. Definition: the nurse-patient relationship is an end result of series of interaction between the nurse and the patient over a period of time, with the nurse focus on need and problem of patient and his family, while using scientific knowledge and the specific skills of nursing profession. Importance of nurse-patient relationship. The nurse helps the patient to cope with present problem. The nurse helps the patient to understand the problem. The nurse helps the patient to understand his active participation in an experience. The nurse assists the patient to identify emerging problems realistically. The nurse helps the patient to find out a new alternative for his or her problem. The nurse helps the patient to try out new patterns of behavior. The nurse helps the patient to communicate. The nurse helps the patient to find meaning in his illness. Component of nurse-patient relationship. First, rapport. Getting acquired and establishing rapport are the primary tasks in relationship development. It implies special feeling on the part of both the client and the nurse based on acceptance, warmth, friendliness, common interests, a sense of trust and a non-judgmental attitude. Establishing rapport may be accomplished by discussing non-health related topics. Trust. To trust another, one must feel confidence in that person's experience, reliability, integrity, veracity, and sincere desire to provide assistance when requested. It is the basic of therapeutic relationship. The nurse must have perfect skills that foster the development of trustworthiness. Clients expect the nurse to have the necessary knowledge and skills to demonstrate caring attitudes and behaviors, and so entrust their care of nurse. Trust is critical as the client is in a vulnerable position in the relationship. Part of trust is keeping promises to client. If trust is breached, then it becomes very difficult to establish it. Respect. To show respect is to believe in the dignity and worth of an individual regardless of his or her unacceptable behavior. Respect for the dignity and worth of the client is fundamental to relationship. The nurse needs to know and understand the culture of other aspects of client's individuality and to take this into account when providing care. Part of respect is being non-judgmental of the client and seeking to discover the meaning behind certain of client's behavior. The nurse can convey an attitude of respect through the following interaction: calling the person by name, spending time with the individual, allowing for sufficient time to answer client questions and concerns. Power. The therapeutic nurse-patient relationship is one of an equal power, although nurses may not perceive themselves as having power in the relationship. Nurses have more power than the client. The power of the nurse comes from authority of own position in the healthcare system, specialized knowledge, influence with other healthcare providers and the client's significant others, and access to privileged information. In any professional client relationship, there is an imbalance of power in favor of the professional and is reinforced in healthcare services. by inherent vulnerability of client needing care. Empathy. Empathy is the expression of understanding, validating, and resonating with the meaning that the healthcare experience holds for client. In nursing, empathy includes appropriate emotional distance from the client to ensure objectivity and an appropriate professional response. First theorist in nurse-patient relationship is Hildegard Bibel. Defined the nursing as significant therapeutic interpersonal process central to all nursing care. Four components are the nurse, the patient, professional expertise, client's need. Phases of therapeutic nurse-patient relationship according to Hildegard Bibel. Pre-interaction phase, introductory, orientation phase, working phase, termination phase. First, pre-interaction phase. Pre-interaction phase is a phase which nurse goes through before actual interaction with the patient. This phase begins when the nurse is assigned a patient to develop therapeutic relationship with him, till she goes to him for interaction. Pre-interaction phase. The pre-interaction phase begins before the nurse first contact with patient. This involves preparation for first encounter with the client. This phase begins when the nurse is assigned a patient to develop therapeutic relationship with him or her, till she goes him or her for interaction. Tasks for pre-interaction phase: obtaining available information about the client from his or her charts, significant other or other health team members. From this information, the initial assessment are begun. This initial information may also allow the nurse to become aware of personal response to the knowledge about the client. Task for pre-interaction phase: examining one's feeling fears and anxiety about working with a particular patient. Set objective for interaction phase. Take help of the clinical supervisor or co-worker to overcome fears. Reactions of nurse in pre-interaction phase. The nurse thinks and feels about the patient before interacting according to her knowledge, fears, and misconceptions. She tries to collect information from secondary sources like the patient's records, a resource person, and other nurses working in the ward. Reactions of nurse in the pre-interaction phase. The nurse plans how she is going to interact with patient, what she is going to achieve from this interaction, and how she is going to help the patient. She plans her objective for interaction phase. Reactions of nurse in pre-interaction phase. The nurse may experience anxiety. Anxiety may be manifested by standing in the duty room and going through the records, talking with clinical instructor. Anxieties may be: will the patient talk to me? He may not accept me or like me. He may beat me. Once she goes to the patient, the anxiety reduces. How to overcome anxieties? She can go through their record, talk to the clinical supervisor or other nurses about her fears, can set her goals, very clearly. Plan a brief interaction with the patient. Introductory orientation phase begins when nurses goes to the patient, introduces herself and gets introduction about him. The nurse and the client get acquainted. The orientation phase ends when the nurse and the patient begin to accept each other as a unique human being. Task of introductory or orientation phase. Establishment of contact. Nurse introduces herself to the patient. Build trust and rapport by demonstrating acceptance. Establishing a therapeutic environment, ensuring safety and privacy. Task of introductory or orientation phase. Making agreement or pact. Initiating a therapeutic contract by establishing a time, place, and the duration of each meeting, as well as the length of time the relationship will be in effect. Task of introductory or orientation phase. Talking with the patient. While talking with patient shows trust in her behavior, the patient may present a prepared speech to the nurse when she asks, "What's your problem?" During this task, the nurse should establish a mode of communication which is acceptable to both the client and the nurse. Task of introductory or orientation phase. Assess the client need, coping strategies, defense mechanisms, strengths and weaknesses. Barriers to orientation phase. Establishing an agreement or pact. Social class of the patient or the nurse. Status of patient. Anxiety level of the patient and the nurse. Transference. When the patient perceives the nurse as a significant individual from the past, for example, they perceives the nurse as his daughter and started behaving with her like a father. Counter-transference. When the nurse perceives a male patient like her father and gives him the same care that she would have given to her father. Working phase. Working phase starts when the nurse and the patient are able to overcome the barriers of orientation and introductory phase. During this phase, the nurse and the patient actively work on meeting the goals, which they have established during the orientation phase. Working phase. The characteristic feature of this phase is that the nurse is able to overcome anxiety and the patient's fear of unknown is also decreased. The nurse collects the data in detail from primary and secondary sources and identifies the needs of the patient. The nurse assists the patient to identify his or her problem. She helps the patient to communicate. She encourages the patient to socialize. The nurse helps the patient to find an alternative solution to his or her problem. She encourages the patient to use a new pattern of behavior. Help the client to develop positive coping behavior. Identify available support system. The nurse helps the patient to understand that he has a significant role in his treatment, exploring the client's perception of reality and provide constructive feedback, developing and implementing plan of action with realistic goals, evaluating the results of plan of action. The nurse prepares the patient for termination of relationship by reminding him during the interview. The working phase helps the nurse to develop knowledge and skill in psychiatric nursing. She identifies her strengths and weaknesses as a nurse while interacting with patients. It enables the nurse to achieve the goals which they have a plan for his phase. The end results lead the patient to verbalize, socialize, identify, and faces the problem realistically. Barriers of working phase. Testing of nurse. The patient tests the nurse for ability and competence. Example: patient, please continue talking. I am very upset today. If the nurse gives into his demand, it indicates manipulation. He may deliberately be aggressive to test whether he is able to arouse anger in the nurse. Barriers of working phase. Progress of the patient. A mentally ill patient may not show a quick progress. He may progress, then regress, and remains stagnant before making further progress. In therapeutic relationship, the nurse must understand the realistic progress in the client. Difficulty in collecting and interpreting the data. The nurse is unwilling to engage in collecting and interpreting the data, applying the knowledge and skills in helping the patient. She finds too hard to do this acts as barrier in completing the task of working phase. Fear of closeness. The nurse feels that she is working closely with the patient. She may find difficult to terminate the relationship. The patient may not like to discontinue the relationship. To avoid closeness, she doesn't communicate freely and makes deliberate attempts to avoid going to the patient. Strategies to overcome barriers. Learn the subject in depth. Taking help from supervisor and experts. Discussions with peer group. Termination phase. The final step of therapeutic relationship is termination phase. The nurse terminates the relationship when they mutually agreed on goals are reached. The nurse discusses the termination phases with the client, encouraged to identify the progress that the client has made and explores the necessity of any referral that may be beneficial to the patient. As separations occurs, clients commonly exhibit regressive behavior, demonstrates hostility or experience sadness. The client may attempt to prolong the relationship as clinical symptoms of separation anxiety are experienced. However, the termination needs to occur if a therapeutic relationship to be a complete process. Preparation for termination actually begins during the initiation phase. Causes: the client is transferred or discharged. The nurse is finished clinical rotation. The patient may go on a parole and doesn't come back to hospital. The client has improved and no longer needs to have one-to-one relationship. Bring a therapeutic end to the relationship. Review feeling about relationship. Evaluate progress toward this goal. Establish mechanisms for meeting future therapy needs. Summarize entire communication and follow-up treatment. All of this is task of termination. Preparation of patient. Explain whatever goals of therapeutic relationship where plans have been met. Allow the patient to talk about his or her fear, and an individualistic approach has to be used. A psychiatric social worker can be contacted to visit the office and family of the patient. The patient may send a parole before discharge so that gradually goes through the weaning of the phase. The patient may be sent through a halfway home. The patient may be asked to attend the daycare center for few days. Barriers of termination phase. The patient may ask the nurse to write to him or come back from duty and see him. The patient may ask the address and the telephone number of nurse and ask permission to visit her in hospital. Gift giving. Barriers of termination phase. The nurse may withdraw earlier from the patient due to her own anxiety. She may not interact with the patient. The nurse may not assess the patient, which she could otherwise do. Strategies to overcome. Nurse needs to explore her own feeling and thoughts about separation from the patient, which will help her to accomplish the task of termination phase. The patient should be explained that every relationship terminates. Getting help from supervisor. Strategies to overcome. After discharge, the patient comes for intervention. He or she should be referred to a second in charge. If the patient is giving some gifts, the patient need to be explained about professional ethics. If he wants to give a gift, he may be encouraged to gift out something for utilization of other patients. Second theorist, Travel B. Overview of Travel B, human-to-human relationship model. Caring involving the dynamic, reciprocal, interpersonal connection. Therapeutic use of self. Meaning of illness experience becomes self-actualization. The term patient is not used. This refers to a label or category of people rather than a unique individual in need of nursing care. The human-to-human relationship refers to an experience of serious experience between the human being who is nurse and an ill person, culminating in the nurse meeting the ill person's unique needs. Hope and motivation are important nursing tasks. Hope helps the suffering person to cope. Nurse cannot give hope to another person, but strives to provide some ways and means for an ill person to experience hope. 5 phases of nursing care: observation, interpretation, decision making, action or nursing intervention, appraisal or evaluation. Meeting spiritual and emotional needs are developed in the progression through 5 phases: original encounter, emerging identities, empathy, sympathy, rapport. Implementation stage of human-to-human relationship model. Selecting and establishing a patient relationship. Process of maintaining a relationship. Ultimate termination of the relationship. The third theorist, Orlando theory of dynamic nurse-patient relationship. Nursing is concerned with providing direct assistance to individuals in whatever setting they are found for purpose of avoiding, relieving, diminishing, or curing the individual's sense of helplessness. Practice should be based on the needs of patient. Communication is essential to understanding needs and providing effective nursing care. Major components: the nursing process: assessment, diagnosis, planning, implementation, evaluation. Understanding the meaning, the perception, validation, nurse-patient interaction, professional nurses. The human transaction between the nurse and the patient in any setting holds the greatest value. Orlando's model, patient verbal or non-verbal language, sense of helplessness, nurse's response, exploration of patient behavior, nurse's action, deliberate approach, patient reaction, need for help, resolve it. Thank you.